Assalamu alaikum. I hope so you're doing fine. I'm Dr. Muhammad Ali Rabani and I'm going to discuss with you the lateral compartment of the lung. And well, this is the overview lecture. And in this, we'll talk about the surface landmarks that are important, the subcutaneous tissue and the structures contained in it, the deep fascia and its specialization, that is extensor reticula, the boundaries and the contents of this compartment. Surface landmarks are not very much prominent for this one. The important one that may come in the discussion in this topic is the condyles, basically the lateral condyle of tibia that comes into the discussion here, the head of fibula somewhere here in the posterolateral aspect, then there is lateral malleolus, and then there is one that is tuberosity of the fifth metatarsal, like it is present here. It is on the base of the fifth metatarsal on the lateral aspect. And then there is peroneal retinaculum, as we can see right here. It is a little bony prominence on the lateral aspect of the calcaneum bone. So this is about that. These are the ones that come into play when talking about the surface marks. In the superficial fascia contains nerves and vessels, and the vessel contained is small saphenous vein. And the importance of the lateral compartment is that it passes from the lateral aspect of foot, from the posterior aspect of lateral malleolus, going to the back of the calf. And apart from that, it crosses very little part of the lateral compartment on the way to the posterior back of the calf. Lymphatics are following the same vein, and they go along with that to the popliteal group of the inguinal nodes in the back of the knee. And the cutaneous nerve that are supplied are two, both of them branches of the common peroneal nerve. On the upper aspect shown in the blue area here are the branches of common peroneal called lateral cutaneous nerves of calf. On the lower part, extending onto the dorsum of the foot, are again a main continuation of the common peroneal superficial branch of peroneal nerve, and that in turn is the branch of the common peroneal nerve. The fascia, like all of the leg, it is the fascia lata that covers the whole of the leg like a stocking, but at this part behind the lateral malleolus, where the tendons are passing onto the lateral and dorsal aspect of the foot, there is peroneal retinacula, upper and lower. The upper one is between fibula and calcaneum as a continuous one, and the lower one it's in two compartments because of peroneal tubercle, or it is divided into two tunnels. We will discuss it further in our separate lecture on the retinaculum. The boundaries. Before discussing the boundaries, let us quickly go through uh, the picture. This is the fibula bone, and this is the tibia bone, and here is the deep fascia, that is the fascia lata that is surrounding. Here is the interosseous membrane, here is the anterior intermuscular septa, here is the posterior intermuscular septa. So this particular compartment we're talking about is this one. This is the lateral compartment, and lateral compartment is bounded medially by the fibula, anteriorly, anteromedially by the anterior muscular septum, posteromedially by the posterior intermuscular septa, and laterally majorly by the fascia lata. And what does it contain? It contains two muscles, peroneus longus and brevis. Beware, peroneus tertius is the part of extensor compartment. It has only one nerve, that is superficial peroneal nerve passing through it. However, the common peroneal nerve enters, divides into deep and superficial parts. So very small part of deep peroneal nerve plus common peroneal nerve are present here. So this is the major one, and these two are minor one. They are present in their terminal and initial parts respectively. It does not have any artery of its own, but it does gets its supply from the peroneal artery on the posterior compartment that we will see in the respective lecture. Thank you so much. If you have any questions, suggestion and feedback, please do let us know, and we will follow with a separate lecture on the muscles of the lateral compartment and superficial peroneal nerve that supplies this compartment. Thank you so much. Till next time.